Binge watch and learn on TRS Clips.
I've noticed that if one visits a dermatologist and say if you have pimples, I've gone myself, I've taken a cousin of mine also. The dermatologist will look at the person's pimple with a magnifying glass sometimes. And from the nature of the pimple, they'll be able to kind of tell what's happening. Like cystic acne versus redness, etc. What's happening in your head as a dermatologist when you're doing
So
that?
when I'm honestly holding, now I'm going to give you one little secret inside. Holding this and all is simply we do. Because I'll tell you, as a doctor with 20 years of experience, I look at you and I know what's happening. Finished. 1 minute, I know what's happening, right? I can dish out and say, but you're not happy. Arey, doctor never gave me time. Doctor didn't look at me properly. So we simply do little looking at times, which is not necessary. Most of the acne times, it's really not necessary because you look and you know the morphology or the type of acne, like you said. Is it all looking similar type of little white pustules? Sometimes it may be, I'm going to throw another angle to your talk. It may not even be the regular thing that you're thinking. It may be steroid abuse acne, which means to say you've used steroid over a long period of time. Then you get something called almost sterile acne. It's not infected, but it looks like acne. Sometimes
What is that?
that looks like acne. It's very difficult to treat
But it's
because
not
you've used
acne.
it's not acne. But you've been using steroid for a long time and that happens. And because this acne happens, you're continuing to use steroid because somebody told you use steroid. And that's a nightmare to treat. So that could be something else. So that I can see by naked eye. I don't need a lens or a mirror to see that.
You're talking about anabolic steroids, right?
No.
Oh,
Application, which is so easy in our country, over the counter. अरे कुछ हो गया, the chemist will say ये लगा लो, Metnovate लगा लो, Tinovate लगा लो, Desoven लगा लो, Elocon लगा लो. All these are steroids which you shouldn't be touching.
You're saying steroid-based
Ointment.
ointments,
Yes.
which are used to treat acne in the first place.
First place should not be used in the wrong way.
That benzoyl peroxide.
Benzol peroxide is not a steroid.
Okay.
Benzol peroxide is a substance or a chemical which actually gives you bacteriostatic, which means it stops the bacteria from growing. It reduces the oil. It's a wonderful thing. For me, that is one of the magic things. Every acne patient goes with the benzol peroxide. But again, it can be very, very irritant to the skin. So it's important to make sure your skin is firstly healthy, can take benzol peroxide. Barrier is protected and healed. Then I give benzol peroxide. We start with a short contact therapy. We do like a 1 hour or a 2 hour to see how the skin is taking it. Otherwise, firstly, you have acne. Then you have a red skin, dry skin. How many of acne patients, I'm really wanting to know. Acne is one thing. You're also worried about what those ointments did to your face. It became red, it became irritated, it became painful, it is tender, you can't apply anything, everything is burning. You don't want that to add on to your acne, right? So therefore, you titrate it in such a way. Okay, I did a separate angle. Sorry.
No, that's fine. That's how podcasts are. We can go back. You were talking about steroid-based acne.
So please don't jump and use steroids for your acne. Be very careful. Number one, long-term use of steroids can cause acne, which is not necessarily the acne that we are talking about. Acne form eruptions is what happens there. So it looks like acne. So everything that looks, that's why you're saying a doctor looks at your skin more deeply. Sometimes it may not even be acne. Sometimes it could be folliculitis on the neck or on the beard area. When men come with saying, oh, I have acne, it could be folliculitis, where the hair follicle is infected. So then we do treat similarly, but a little differently there. So that's not necessarily hormone induced. Then acne itself, like you said, if it is red, if it is angry, we know it's very inflamed acne. If there's a lot of pus there, if it is also painful, it could be inflammatory and infected. First, it could just be a blackhead. It could just be a whitehead. Those are first grades of acne, initial stages of acne. Then you can have all of them at one point. Then you can only graduate and become very painful, hard pimples and nodules they become if they become really hard. So it could be that. In which case, sometimes you may have to cut open and remove the whole capsule. Sometimes we may inject a little steroid into it to suppress the inflammation. All this is done judiciously, but go to the right doctor. Don't treat acne like, arey, ye to acne hai. No.
I think until this point of the podcast, we've only addressed that root cause problem. Correct me if I'm wrong.
Yeah.
But all these actors, models, content creators, influencers who come to you, a lot of them come for cleaning up their skin in the short term as well. That's my assumption.
Happens because tomorrow they have a shoot. Then there's an acne today. What happens? doc, fix me now, then we'll figure out. It's like that. That happens.
And what's the medical treatment for that?
So if you do have one acne sitting there, which is irritating, we all know makeup can cover imperfections in terms of color. Surface imperfections are very difficult to cover. So I understand it's their emergency. So we end up giving in a tiny bit of steroid, we call it intralesional steroid. But, please go to our qualified dermatologist. Please don't do it excessively. That can cause a side effect of causing like a khadda on your face if it is done wrongly. So go to an expert, make sure the right amount, right quantity, right little bit is put in there to immediately suppress the inflammation. You can cover them with an antibiotic if you think 2-3 are there and if it looks inflamed or infected. It depends. I may simply give also like a anti-inflammatory, an enzoflam to pop. So the inflammation, the redness, the itching goes down. Sometimes acne is with an inflammatory background. So there is any itching in your acne. If that is there, then there's also an inflammatory background there. So I give simply anti-inflammatory with the acne therapy. Gone are the days that antibiotic was given for long. I, for one, don't believe in giving too much of isotretinoin or tretinoin, whatever you call it. I, for one, don't believe in it. We'll get there when you ask me those questions. So, like I said, we are dwelling deep and asking, is it food? Is it pollution? Is it hormone? It could also simply be an inflammatory acne, an allergic acne. You got to something that you just applied a cream and you can break out. Like, for example, I'm a derm, right? So I keep getting Hajar products to test. So yesterday I saw some bottle which looked very, if you touch me, you will see there's an acne now. And for me, I've never had an acne in my life.
You have amazing skin.
Thank you. It's genes. I want to say, oh, it's all me, but Mangalorean genes as well. And very, very disciplined lifestyle. We were just talking before and you said, what helped me is discipline. I want to say, I am born like a military regime. Till date, I have an alarm in my head. I get up at the same time. I sleep around the same time. I eat around the same time. I eat the same thing. It's regimental lifestyle, which is lead to good skin. Anyway, so my point is I have an acne because day before yesterday, somebody got me some beautiful serum and said, doc, we want you to test it. Last morning, I was looking, I had put it on, left it for some 2-3 hours. Later in the clinic in the evening, I could already feel something happening. By night, I knew there was an acne. So it could just be that. So causes of acne, like you rightly said, can't be covered in a 2-second Instagram video. When people tell me talk about acne, people's attention is short. Please do it within 1 minute. Like I can't.
But how about a 2-hour podcast?
I think this is leading there.
No, but can it?
Yeah, of course. I mean, it's interesting for a person who's interested and who's affected. I don't know how much interesting it will be in such depth for a person who's not affected.
Pimple related videos, if the content is strong, are some of our short hits.
Wow.
That's how much the country is suffering.
Yeah. You know, Singapore had declared acne as a pandemic at one time.
Really?
They had so much acne and it had become all resistant because everybody gave antibiotics to it. This was some years ago and it had become resistant. So that is when people started shifting from giving. Earlier, they used to give antibiotic for 6 months, 3 months in acne. Now, I, for one, give you for maybe 10 days. Worst case scenario, I also give pulse therapy wherein I give you a 10 or a 15 day, then I give you on a just weekends for a couple of times till I get the control of that infection, that too in severe cases. Otherwise, 7 to 10 days is all that I give initially to just get rid of that infection on your face. So anyway.
So TRS Clips has all sorts of videos and all sorts of playlists. Make sure you explore the channel by subscribing and heading to our homepage and reading through all the playlists. Happens to